Hey guys, Dr. Ron Donato here with FAM Chiropractic Center and CrossFit Iron in the Fire in Lumberton, New Jersey. I'm here with Kelly Baker. She is a CrossFit athlete. You might recognize her from the CrossFit Games 2016 with Team Parallax. They had an amazing journey from South Jersey. Really did a phenomenal job. Now, today we are talking about IASTM, more specifically with HawkGrips. We're talking about injury prevention and performance enhancement as opposed to just dealing with injuries. Most people know about the benefits of chiropractic, physical therapy, acupuncture, other conservative means of treating injuries. But we want to take it a step further and talk about injury prevention and, like I said, performance enhancement for our athletes. Now, full disclosure, competitive CrossFit athletes will have aches and pains and tweaks. Same can be said about any competitive sport, football and soccer, even baseball, right? So our goal is injury prevention. As a CrossFit affiliate owner, it's a bad look for me to have a gym full of injured athletes. So again, we're trying to get injury prevention going. We do that by breaking down any kind of scar tissue that might be building up over time that a patient might not necessarily feel right away. We are also trying to increase and maintain full range of motion. Now, Kelly here is not injured, right? She has full, normal range of motion in her, in pretty much every joint. But I know from watching her as an athlete that she might have some issues specifically in her right shoulder. As humans, we are one side dominant, whether that's a leg or an arm. We tend to favor one side versus the other. That could lead to biomechanical instability and favoring one side, using muscles that we're not supposed to technically be using. So again, harping back to the injury prevention performance enhancement, the best way to do that and the most time efficient is with instrument-assisted soft tissue mobilization. We're going to kind of jump right into the treatment protocol. Now, again, because I know Kelly, I know exactly where we're looking. We're looking at specifically the rotator cuff group, her two muscles of complaint, supraspinatus and subscapularis. So those are the two muscles that we're going to isolate today and take care of. All right, guys, so we have our emollient here. Now we do a protocol called scrape, tape, and move. We want to get our athletes moving as soon as possible after a treatment. We might get a lot of misconceptions out there are, after a session of IASTM, you want to rest the area. The best thing you can do is move it. Keep moving. Test it out. See how it's feeling. All right, so we're going to get some emollient on Kelly's shoulder here. Again, going after supraspinatus and subscapularis. Now, luckily, their insertion point is very close. We just have to expose the tendon in different ways. So what we'll have Kelly do to get a hold of subscapularis insertion, we'll have her keep her arm in a neutral position here. All right. I always start with the broadest base I can. That's with HG8, now HawkGrips 8. Like I mentioned, I teach seminars with DC seminars. I must have had my hands on 100 different tools, Kinetics, Graston, even sound-assisted ones. I say this without any hyperbole. They're not paying me to say this. These are the best tools. HawkGrips, by far, is the gold standard for a number of different reasons. Number one, I have never had an adverse reaction for a patient. This is an American-made surgical steel. You're not going to get any pitting, again, any adverse reactions to the skin area. Okay? So we're just going to go nice and light, try to identify any kind of scar tissue we can feel a little bit in there. And Kelly's going to give me any feedback. You can feel kind of like a little bit of grittiness. Mm-hmm. Now, Kelly just finished up a competition. Where was it, Kel?
In Maryland.
Maryland, okay. It was shoulder heavy, a lot of ring muscle ups, strict handstand push-ups, overhead squats. So it's not surprising that we're feeling any kind of scar tissue in here. What we want to do is just kind of break it down. Now, with any kind of instrument assisted, we want to follow the rule of 7. Now, we never want to be above a 7 out of 10 pain-wise. That's another misconception that I see a lot. A lot of athletes and doctors of physical medicine or any kind of practitioner will have the misconception of this has to really hurt or we have to get a ton of bruising. It's not the case. You can be efficient and effective by just getting a little bit of petechiae or redness in the area of complaint. you shouldn't really have a whole lot of bruising. If you have a lot of bruising, then you're kind of just wasting a lot of energy and time. Just, to be honest with you. So what we're doing here is just kind of breaking down the area, and we're not getting anywhere near a 7, right, Kel?
No.
Good. Okay. Good. And you might see a little bit of redness that is completely normal, but again, excessive bruising is unnecessary.